If you own an allergic dog, you know the sound. It's 2 a.m. and the relentless thump, thump, thump of a back leg wakes you up. Again. Chronic itching from atopic dermatitis leads to secondary skin infections and long-term changes to the skin's texture. Beyond the physical damage, the sleep deprivation and stress affect everyone in the house. The good news is that veterinary medicine finally has more than one highly effective answer to this problem. The allergy arsenal has expanded. Pet owners now have 3 main contenders for rapid itch relief: Apoquel, Zenrelia, and Numelvi. All 3 are in a class of drugs called JAK inhibitors. Think of them as a cellular mute button. When the immune system screams at the dog's brain to scratch, these medications literally switch off that specific chemical signal. Because they target the same pathway, all 3 medications achieve the same immediate result. They hit the mute button fast, often providing relief within hours. Since speed isn't the differentiating factor anymore, choosing the right medication requires parsing the specific trade-offs in daily routines, their safety profiles, and strict age requirements. Let's start with how you actually have to give the medication every day. Apoquel operates on a traditional protocol. To get the allergies under control initially, you give the pill twice a day for the first 14 days. The trade-off happens on day 15. When the dose drops down to once a day, some dogs experience a rebound itch as their body adjusts to the lower level of medication. Zenrelia and Numelvi take a different approach. Both utilize a simpler once-daily dosing structure directly from day 1. The steady baseline prevents that day 15 rebound itch entirely. The trade-off here is adherence. You must be rigorous about giving the pill at the exact same time every day to maintain continuous relief. Before we continue, don't forget to subscribe, like, and share to help more pets live healthier, happier lives. The next major filter is your dog's physiological age, because these drugs actively modulate developing immune systems. Apoquel and Zenrelia share a strict boundary. They are only approved for dogs 12 months and older. Numelvi addresses the puppy dilemma. It offers immediate relief for dogs as young as 6 months, provided they weigh at least 2 kilograms. Modulating the immune system comes with expected physiological side effects. Across all 3 drugs, the most frequent reactions form a common gastrointestinal trio: early onset vomiting, diarrhea, and lethargy. These GI issues are usually mild, temporary, and can often be managed simply by giving the pill with a full meal. Less commonly, altering the immune response can allow benign physical growths, like papillomas or interdigital cysts on the paws, to emerge. Zenrelia has specific clinical monitoring considerations. Veterinarians watch for risks tied to liver and pancreas health, including adenoviral hepatitis or pancreatitis. The reality of long-term use is that all JAK inhibitors require periodic blood work. However, Zenrelia requires the most active veterinary partnership for follow-up testing to monitor internal organ health. These pills are highly effective at restoring comfort, but they are powerful pharmaceutical tools. They require active owner vigilance and regular, routine vet visits, not a set-it-and-forget-it mentality. The most significant logistical difference between these medications revolves around vaccination scheduling. This chart highlights drug safety labels. Zenrelia has a strict boxed warning for vaccines. You must pause Zenrelia up to 3 months before modified live vaccines and 28 days after. Apoquel offers flexibility. It can be given alongside vaccines without interruption. The real-world trade-off of Zenrelia's warning is that a dog may endure weeks of itch during vaccine seasons to ensure an adequate immune response. Numelvi, similar to Apoquel, does not carry this restrictive boxed vaccine warning. This simplifies the schedule for owners who have dogs on active booster routines or those with unpredictable veterinary schedules. For many owners, the dog's annual vaccination schedule will ultimately be the deciding factor in which drug is practical for their lifestyle. To match the right drug to your daily reality, let's look at 3 common owner profiles. Profile 1 is the long-time user. If your dog is already thriving on their current routine, or if you need absolute flexibility around their vaccine schedule, Apoquel remains the standard. Profile 2 is the convenience seeker. For severe cases, Zenrelia achieved a 77% clinical remission rate in itch by day 112, compared to 53% for Apoquel, making it a viable choice for those who can manage the vaccine pauses. Profile 3 is the puppy owner. Numelvi is currently the only JAK inhibitor indicated for dogs in this younger age bracket, providing relief for dogs as young as 6 months without vaccine interruptions. The best medication is subjective. It has to fit both your dog's biology and the logistical realities of your daily life. Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life. Take these scenario frameworks to your next vet appointment. Knowing your routine and priorities, you and your vet can make a confident, collaborative choice.